Today, we're privileged to be joined by a guest who brings a perspective that may not align entirely with the points we've explored in past episodes. And that's precisely why we're excited to have them on the show. At Outside Counsel, we believe that no issue can be fully understood without considering all of its dimensions from people with different perspectives, because that's how we find nuance, understanding, and hopefully common ground. So let's dive in.
We need to make sure that all of our patients have what they need to access care, including those suffering from pain, as well as people who are suffering from addiction and mental health conditions. But provider shortages in all of those areas is a real issue in my state.
On this special two-part episode of Outside Counsel, we dive into the complex and deeply personal journey of pain patient advocacy with Claudia Merandi, founder of the Don't Punish Pain movement and Doctor-Patient Forum. What began as a grassroots effort with just 3 members has now grown into a nationwide movement with chapters in all 50 states, advocating for the fair treatment of pain patients and the doctors who care for them. Claudia, thank you for appearing on Outside Counsel. Please tell us a bit about yourself.
So I was very sick for many years with the debilitating form of Crohn's disease. I was a court stenographer. I owned Merandi Court Reporting, and due to the severity of my illness, I went to the emergency room for help. I was accused of drug seeking, and I was humiliated, discharged, only to be readmitted the next day. And I left the hospital with a colostomy bag. And it was all because a doctor thought I was drug seeking. And that was probably in 2013, 2014, before opioid guidelines came out. My mom, who is 89, said to me, if this is happening to you, this is happening to other people. I went on social media in 2017, and I announced I was going to organize a protest for people who couldn't get their pain treated. Started with 3 members. Today, there's over 30,000 chapters in all 50 states. And we raise awareness to the victims of this is an undertreatment of pain that's been brought on by opioid lawsuits, multi-district litigation, and pretty much the war on pain management doctors. So that's how I started as a vocal pain patient advocate.
I am on the other side of that debate in some respects. In other words, I am an attorney who has been involved in opioid litigation. However, I am also an advocate for the pain patient community, and I certainly agree that opioids, when denied to people in acute pain out of the doctor's concern or mistrust of the patient, has become very problematic as we try to deal with the dimensions of the opioid epidemic. But I don't mean to assume too much here. Do you believe there is an epidemic of opioid overdoses and addiction in America, or do you not?
I don't. I think that the CDC conflated overdoses. They lumped heroin overdoses in with prescription overdoses, and they silently acknowledged that they did lump in the overdose, the count, and it turns out it was 16,000 people who died from prescriptions. And originally that number was 100,000, and then they reduced it to 67,000. I don't believe that people were overdosing because of a doctor's legal script. I believe people were overdosing because they obtained those medications illicitly. Today, there's 100,000 dead people. I believe the non-medical users have died, right? So before they had like a safe supply of drugs that was keeping them alive, but it's actually quite rare for a person like myself to graduate to street drugs because of a doctor's script. The data clearly supports that. You hear a lot of people say 80% of heroin users started because of a doctor's script. The truth is 90% of that 80% obtain those medications illicitly, which would explain why my constituents are still here. The non-medical users have sadly died. I believe, Jeffrey, I believe there was liberal prescribing happening in the United States, but I'm 56 years old. I lived in a hospital bed for 10 years. I've never been overprescribed opioid medications. In fact, it was always so difficult to get my pain treated.
There's some new data on some of the issues you described there, and I'm interested in your reaction to them. There's a paper that came out recently in the Journal of Clinical Psychiatry. It's called Prescription Opioid Use Disorder Among Adults Reporting Opioid Use with or Without Misuse in the United States. And in short, the researchers used questionnaires to do a cross-sectional survey of 47,000 or so people who reported having used an opioid by prescription in the previous year. And according to the questionnaire, so this is self-reporting of what's happening with these patients by these patients, the researchers found that 7% of those who took an opioid by prescription the previous year reported being addicted to them, which they then extrapolate to being 4.8 million Americans. As you hear those numbers, how do you react to them?
I would have to research the researchers because I simply cannot trust the research that has been dispersed to Americans, because what I've learned as a vocal pain patient advocate, the people who speak out against opioids have been paid to. Very difficult for me to find any expert who hasn't been paid to speak out against opioids. I don't believe that being exposed to an opioid causes addiction. I don't believe that exposure causes addiction. I've got a 23-year-old, a 19-year-old in college. And the way I like to explain it to people, if exposure caused addiction, then every college student exposed to alcohol would be an alcoholic. So
I understand the point you're making. I think what people who have a different point of view would say is it's about dose and duration. As they increase, the risk of addiction goes up. That, sure, a person who smokes a couple of cigarettes or has a few drinks in college, most people who do that don't develop an addiction to either cigarettes or to alcohol. But among those who smoke more and more, or drink more and more, or are prescribed opioids in greater doses for longer durations, their risk of becoming opioid addicted goes up. That's the thesis. How do you react to that thesis?
I think opioid addicted is something different than opioid dependent. I think we keep using a word addicted. We've made it an ugly word now. We've created such a stigma, but there's a difference between dependence and addiction. Opioid use disorder, I believe that was a diagnosis that was created to market Suboxone. I don't believe in opioid use disorder. The psychiatrists who created that diagnosis have been paid millions of dollars by the makers of Suboxone. Basically, if you look at an opioid, a doctor could diagnose you as having opioid use disorder. I think this was an attempt to eliminate the opioid. It has backfired, and now people are having limbs removed, and they're being told that they shouldn't have any pain and Tylenol should suffice. And Jeffrey, you and I, we're not getting any younger. And life can change for either one of us in the blink of an eye. And until you have been in the shoes of somebody like myself or my colleague, you have to understand these are life-saving medications. I believe there was liberal prescribing. And whenever I testify, a lawmaker will say, is the pendulum swinging back? I don't know if we had a problem with the pendulum to begin with, because we have been lied to so frequently in the United States. I don't know what to believe anymore. So you just mentioned a study to me. Now I want to research the researchers, the peer reviewers. How much did these people get paid? Because a lot of these people, they're not disclosing their conflicts of interest. So I think this is something that needs to change in the United States.
One of the criticisms of opioid manufacturers is exactly what you're describing with respect to other researchers about whom you have suspicions, specifically that they promoted opioids with fake science or pseudoscience without disclosing their conflicts of interest, specifically that they were being paid by opioid drug manufacturers to do so, a term sometimes called key opinion leaders. Are you familiar with at least that thesis? And if so, how do you react to it?
Oh, I'm absolutely familiar with it because the same thing is happening today with Suboxone. The makers of Suboxone and Divir are doing the same things that we vilified the Sackler family for, which is why I put my face on the Suboxone dental decay lawsuit. I've never been prescribed that medication, but the way that medication is being glamorized in the country today is appalling. Suboxone is a highly addictive opioid. And the way it's being marketed, doctors are espousing it as if it's drug free. You'd be crazy not to take Suboxone. So I don't think the opioid makers did anything differently than the other pharmaceutical companies are doing today. But whatever the Purdue company was guilty of doing, the makers of Suboxone are doing today. They're actually paying people to take an opioid, Suboxone, and it's just being glamorized. Are the Sackler family, are they angels? Absolutely not. But they didn't do anything differently that the other drug makers are still doing today.
The conventional wisdom in medicine and science in America is that we had a prescription opioid overdose epidemic for a period of time extending from the late 1990s into around 2012 or so, which then morphed into an illicit opioid epidemic. That's the thesis. Do you agree with that thesis? There was one that was prescription, it morphed into something illicit.
I'd like to have the true number of how many people overdosed on prescription opioids alone that were prescribed to that individual with nothing else in their system. We can't get that number because I don't think they count deaths like that in the United States. But you know what, Jeffrey? If we did, that was then. This is now. We're using data that's 20, 25 years old. We have new data. It's time to change the course. It's not uncommon for people to call me before their first suicide attempt. People mail me their house keys. There's a suicide study being done out of the University of Alabama for veterans for anybody who was cut off of their medication. See, there's one thing that's happening here that never happens in medicine. The government shot first, asked later. This is asked later, but nobody ever followed through with how are the patients doing? See, patient outcome was never measured in this aspect of medicine. That never happens. And to be quite frankly, I've got to ask the question, is it because we're disabled? Is that why we don't count? Why have our voices not been heard? Why have we not been invited a seat at the table? But another very important part of my work is raising awareness to doctors, elderly doctors who are incarcerated for treating pain. And that was another aspect of this that I didn't know about. And I was assigned to the federal grand jury as a court reporter. I've witnessed prosecutors delivering a kernel of truth to satisfy their narrative, which has basically landed these poor doctors in prison. And of all people, you need a few $1 million to defend yourself from the government. So that's another aspect of what's happening. We've created, or the government has created, a machine that nobody knows how to stop this. We're in a dire situation.
Yeah, I'm certainly aware of a point that you've made there that I think is correct and requires emphasis, which is that on the one hand, there certainly are physicians who turned opioid prescribing into a business and were pushing the drugs and not looking out therapeutically for their patients, but rather economically for their own interests. On the other hand, there were physicians who were dedicated to patient care, dealing with patients in really dire circumstances, intractable, constant pain, who were prescribing consistent with at least the science they had been provided, whether it's from sales reps, whether it's in continuing medical education, or other kinds of prescribing protocols, who have been prosecuted and say, hey, wait a minute, two things can't be true. Either they misled the medical community, they being the opioid manufacturers, and therefore misled me, or something is amiss here. Why am I the one going to jail? Have you seen some of that?
They call me from prison all the time. I've had 3 missed calls from doctors in prison today, and I'm their lifeline. I'm the only voice that these doctors have. One of our doctors, 88 years old, was just released from prison on a compassionate release. He was shipped off to prison at 86 years old. The charges against this man, his son is also a neurologist. I can't even wrap my head around what is happening here. It's really changed how I view the United States justice system. And he was released because he has terminal cancer. And the United States, the attorney for the federal government, didn't believe that he had cancer and needed a biopsy. They're so intent on terrorizing these doctors. But for each doctor you arrest, you deter 3,000, 4,000 other doctors from treating pain. That's where we are. And I want to go back to what you just said about doctors. There's good doctors and bad doctors. There's good patients and bad patients. I've got Suboxone doctors who are just accepting cash. They're writing mega doses of opioids. They're not following up with these patients. They're calling me because they're addicted. They are addicted to Suboxone. So the same thing is happening. It's happening in real time, just with the different opioids. Nobody is acting reasonably at this point. Nobody knows what to do. I met with Senator Sheldon Whitehouse and Senator Jack Reed. Whitehouse serves the committee that conducts oversight of the DEA. And he asked me, what do you want me to do? I was like, you're a United States Senator. You're asking me what needs to be done? We need to rein in the DEA. We need to rein in the DOJ. It needs to come from the White House. See, here's the problem. Those 2016 opioid prescribing guidelines that were created, they had no evidence behind them. The people who created the guidelines were already paid to speak out against opioids. Those people would end up being experts in multi-district litigation. And you would hear these lies throughout multi-district litigation. Like one of the lies is, turns out opioids aren't effective for pain. That's the dumbest thing I've ever heard in my life. Opiates have been around for thousands of years. So we started with opiates aren't effective for pain. And now I'm hearing doctors tell patients opiates cause pain. That's not true. I feel like I'm swimming amongst a sea of followers. See, so many of the doctors are followers. The younger doctors, they've been indoctrinated. Opioids are bad. See, they infiltrated the medical schools. See, those same people that wrote the CDC guidelines, now they're teaching other doctors. Opioids are bad. Opioids don't play a role in medicine. And now they're coming for the other medications, like the stimulant medications, the benzodiazepines. That's when people will start jumping out of windows.
So the CDC guidelines that you're referring to, I'm familiar with them. And as I recall them, they were that opioids are appropriate medical response to acute pain because they are effective in providing pain relief, or what we call analgesia. How else are you going to get the ski boot off my broken leg? You certainly can't get that done humanely with Tylenol. And also that opioids only provide a short-term benefit. That is, that our body develops tolerance to them. And so in order to manage pain over a longer period of time, say more than 7 days, opioids are not safe, generally speaking, because you have to prescribe greater amounts of opioids in order to treat the same pain. And as you do that, you increase the risk of addiction or overdose. That's the thesis. Having said that, the CDC did modify those guidelines later. Could you tell us about that?
Sure, they were forced to update the guidelines in 2022, but those guidelines haven't been implemented. See, the Department of Justice is still using the 2016 CDC guideline within their algorithm, as well as insurance companies, as well as the Office of Inspector General. And there's all these different softwares that everybody's using to target doctors, except they're using an outdated guideline. So we have to de-implement the 2016 CDC guideline, and we need to implement the 2022 guideline. But those guidelines have been codified into 33 states. And now we have these ill-informed lawmakers, right? They sell insurance during the day, they practice medicine at night, and they have decided we're going to write guidelines about how a doctor should treat pain. What? It took me 4 years to get a law passed where I live. 4 years in Rhode Island. But the law is useless because it's not being enforced. Their data is old. And I think it's such an undertaking that I think these people think they'll just stop complaining. Yeah, we just have to wait for all of the pain patients to die off and then everything will be fine. That's not going to happen. Even though the guidelines were updated, they're not being recognized. And some states say we don't want to recognize them. We like the 2016 CDC guidelines. I've got doctors in prison because they prescribed above 90 MME. And then the next thing you know, they're charged with writing scripts that were not medically necessary.
Have you learned that treating chronic pain is not a one-size-fits-all proposition, whether it's opioids or something else?
Oh, God. Yeah. Listen, for me to stay in remission, it's a full-time job. I'm a fitness competitor. That means I get on stage in a little tiny bikini, right? I'm a bodybuilder. But for me to stay in remission, I have to eat a certain way. I have to go to physical therapy a few times a week. I have to take a form of chemotherapy. I have to sleep 9 hours a night. Opioids are a very small part of maintaining remission. And the way that these so-called experts have portrayed the pain patient, it's like we're all lazy, drug-seeking malingerers. We stay home all day, drink coffee and smoke cigarettes, and we don't have teeth. So that's why it was really important for me to put my face on this cause, because opioids are a very small part of a pain patient's life. It's an essential, important part, but I have to go back to something you said. Another misnomer is pain patients will always need an increase in opioid medications. I never needed an increase. I'm not an anomaly. I never graduated to heroin. I never needed Narcan. This was a well thought out plan. I don't think anything that's been done has helped Americans. We've somehow managed to kill 100,000 people in the process of eliminating full agonist opioids.
It's interesting, your perspective about opioid-related litigation. Obviously, you're certainly entitled to your opinion, but as a participant in that litigation, I actually share a central point of view with you that I believe we've advanced in the litigation, which is that you and I both know that addiction to opioids, whether they are prescribed or illicit, is a disease. It is not a character flaw. And one of the marketing strategies of Purdue Pharma and some other drug companies, but they're the ones that have certainly become infamous for it, was, remember the phrase, hammer the addicts, right? In other words, that addiction is a sign of abuse, when in fact there's a great deal of data that shows the opposite to be true. How has your work involved trying to make lawmakers and the larger public understand addiction is a brain disease, not an expression of who you are as a person?
At the doctor-patient forum, we don't believe that addiction is a brain disease. I think and I advocate for addicts all the time. My addicts are treated like rabid animals. when they get taken to the hospital. They're treated horribly. I had one gentleman who, because he was on Suboxone, the hospitalist decided to withhold all pain medication from him, as well as Suboxone, and he was just in a near-death accident. He lost a leg. So I can tell you firsthand how horribly they are being treated. However, I don't believe addiction is a disease of the brain, nor do many experts. We've had a lot of them on our podcast. I think when we say this is a disease of the brain, we remove accountability. I don't like to remove accountability. People made some bad decisions. So I don't believe it's a disease of the brain. I believe that people believe it's a disease of the brain. I also think that was just another marketing tool in overprescribing Suboxone. But I advocate hard for people with addiction because they really are treated horribly.
Tell us about the doctor-patient forum, please.
Yeah, so we started off originally as Don't Punish Pain Rally. When I went on social media, announced I'd organize a protest for people who couldn't get their pain treated, my vision was, okay, if I could get everything taken care of in the smallest state where I live, Rhode Island, then other people would follow suit. So we were known as Don't Punish Pain Rally. I organized 33 rallies on 33 states on the same day at the same time. And eventually we grew into the nonprofit we are today, the Doctor Patient Forum. I have my vice president, Bev Schechtman, who is honestly the Rain Man of opioid data. Nobody knows the data better than Bev. And now we travel across the country. We organize these support groups. We have a presentation. We just had a successful one in Michigan. I flew out there. I take my 19-year-old with me because my 19-year-old didn't have me for years, right? I was always in the hospital. And we raise awareness to the victims of the undertreatment of pain, and we offer solutions. We have the solutions. We need lawyers like you, though, Jeffrey, because I don't think we're going to find out our way out of this mess unless there's lawsuits. Because let's face it, this country thrives on litigation.
We are a litigious society, to be sure, and it stirs my heart that you talked about Bev, and I assume you'll talk to her later today or tomorrow. And when you do, tell her for me, please, that Jeffrey and Outside Counsel kept its promise. Because we looked long and hard to find someone who would offer your perspectives, of which she has similar ones, because she pointed out to us correctly that this point of view was not presented during our first season, which was about the nature and dimensions of opioid use in America, and that it was missing. And so I made her a promise that in season 2, we would have someone like you. And you're a little bit fabulous, and so is she. And please tell her how much we appreciate both of you in having made that happen.
I will. Yeah, what we hope to achieve at the Doctor Patient Forum is get a version of my bill in other states, which has already happened in 5 other states. We have a version of the Rhode Island bill, and get a version of that on a federal level, because that's really what's needed. If the doctors don't have immunity, nothing will change because they're afraid. They should be. I've got a friend who's considered to be the high prescriber, but there's always going to be the high prescriber. But the DEA keeps shutting down the high prescriber to avoid diversion. You're never going to stop diversion. You can eliminate all the opioids in the United States, but you're never going to eliminate the addict, because I believe people are predisposed to addiction. Most of the people I advocated for with addiction come from a long line of others who struggle with addiction. They've been through some very difficult times in their life. And I can tell you the smallest part of their problem was finding their way to an opioid. We've got a massive mental health crisis in the United States.
Thank you to my guest, Claudia Merandi, for this insightful conversation. Tune in to the second part of my discussion with Claudia, where she reveals the human toll of what she says are outdated opioid guidelines, defective insurance policies, and unfair criminal prosecution of compassionate healthcare providers. She emphasizes the urgent need for updated guidelines, criminal immunity for doctors treating pain patients, and the removal of stigma surrounding opioids as a critical tool for managing pain.
This podcast is produced by Shannon Saletti of Rebel and Convey and Larry Shavana.
The opinions expressed on Outside Counsel are neither legal nor medical advice. The views and opinions expressed in this podcast are those of the speakers, guests, experts, and/or host. They do not expressly nor necessarily reflect the opinion of any institution with which I am or ever have been a member and should never be attributed as such. Thank you for tuning in to another episode of Outside Counsel. I'm Jeffrey B. Simon.